The coronavirus pandemic has taken a massive psychological toll on people worldwide. From recovering from serious infections to experiencing deaths in one's family or circle of friends, or even job loss and isolation, people are coping, at least in part, in very different ways. On today's program, we'll see how volunteers in places like India are looking after coronavirus patients. But in other parts of the world, people are ignoring the virus and the risk of infection. But first to Hong Kong, where those entering the country first have to quarantine. Our reporter Hang Shen experienced it firsthand, but didn't let it bring her down.
COVID-19 not only causes an illness with physical symptoms, but it can also impact your mental health. Throughout the pandemic, coronavirus restrictions put many people in a form of isolation that is unprecedented in the modern world. I also experienced it in quite an extreme way during a 14-day quarantine in Hong Kong. The city is well known for its harsh coronavirus restrictions. I was confined in a hotel room, not allowed to see anyone, and I'd like to share with you how the confinement turned out for me. This is the hotel room where I stayed for 2 weeks. I have to say that I was among the lucky ones. My room was relatively comfortable. I could open the window a little bit, even though this is forbidden in a lot of quarantine hotels. And from the window, I could observe how people were living their lives. I got my meals 3 times a day. But that didn't mean I got to see anyone in person. When I arrived, it didn't take me long to discover this little notebook. I quite like this sentence on the cover. If you don't like something, change it. If you can't change it, change your attitude. Out of curiosity, I checked out the term Reinfection online. It's a program organized by the Center for Suicide Research and Prevention at the University of Hong Kong. Hello. Well, I had nothing to do, so I decided to call them up. What happens when people are isolated for too long?
Our university did a number of surveys throughout the pandemic. A lot of times, the interviewees said they felt very lonely. Their level of anxiety and depression also increased. Human beings are very used to being in control of something. Normally, we can decide what to do and what not to do. But during a quarantine, this isn't really the case. So, in our booklet, we introduce some little exercises to make people feel that they have the power to decide on something again. We also asked people to clean their rooms or dress up, even if they're not going anywhere. All of these things can bring back the sense of control.
Little practices like this. Brewing and savoring a cup of tea to train our mindfulness. And they also told me to exercise every day. It felt good. Another tip from the team was to stay connected with others. I was really glad to have many friends visiting me regularly. Additionally, I set different personal goals, like practicing guitar and learning Russian a few times a week. I was isolated, but did not feel lonely. Another week passed by quickly. Soon I found myself packing my luggage once again. In about 10 minutes, I will leave this room. After 14 days of quarantine, I'm super excited, but I'm also a little bit scared to step out of this room. I've been captivated for too long. Anyway, I'll see you later. Bye-bye. The first welcoming hug ever since I arrived here. After my friend picked me up, we took a taxi back home. Hello, I'm almost there.
first time seeing my parents again in 2.5 years.
Unfortunately, Hong Kong is experiencing its worst coronavirus wave ever, despite its tough rules. The government is responding with even tougher measures to curb the spread of the virus, so for me it's like moving from one quarantine to another. But I think my experience in the past 2 weeks has made me mentally a little stronger. It is a difficult time, but I'm sure everything will turn out fine. And if you are in isolation right now, please hang on, because one day it will be over.
While some are learning to cope with quarantine and isolation, others are still trying to ignore the coronavirus 2 years into the pandemic. This is not only prevalent in European countries, including Germany, but also on other continents. In Brazil, the population's willingness to wear a mask or to get vaccinated has declined significantly.
In the past year, Carola Barcelos Marcel has administered more than 15,000 doses. She's convinced that the vaccine is the only way to control the pandemic. Although the unvaccinated are a minority in Brazil, they represent 88% of current hospitalizations in the country. Working on the front line, she has witnessed the skepticism of many. A lot of people are coming to get vaccinated for the first time now, while some are even taking the 4th dose. Many are only coming now because they have an uncle or a sister or someone close to them who got the virus and developed a complication or is intubated. And that has made them realize the importance of the vaccine. Last month, Brazil recorded the highest number of new infections since the outbreak of the pandemic, even surpassing the deadly peaks of the first and second waves. Almost 100% of those cases were caused by the Omicron strain. But despite the difficult situation, barely anyone still wears a mask or maintains social distancing. After 2 years with the virus, Brazilians are tired of the restrictions. But relaxing those restrictions could lead to an explosion of infections. Researcher Vinicius Oliveira from Fiocruz, one of the most respected scientific institutions of Brazil, refuses to meet us in person to avoid the risk of transmission. He anticipates a challenging situation in the coming weeks.
We'll see a large increase in the number of infections, even much larger than the testing capacity. So we'll need to look at this data very carefully. We'll see an increase in hospitalizations and deaths, which will continue to rise for another month or two. We'll maintain a high level of hospitalizations compared with what we had in November and January.
Carola finishes her shift at this health centre and goes to another one, where she also works. She knows that the unvaccinated, under threat from the contagious Omicron variant, could push the country's healthcare system to the limit.
Even as many countries in the world have been easing their coronavirus restrictions, the pandemic is still omnipresent. Children, in particular, have suffered a great deal over the past 2 years. They've often not understood what's happening around them. That makes it all the more important for adults to take the time to explain it to them.
Children pick up far more than adults realize. COVID measures affect them directly. They see images of the war in Ukraine in addition to news about animals going extinct and the worsening climate crisis. Sometimes they simply feel the tension, fear, or anger of the adults around them. That is why it is important that we talk to kids about the crises. But how do I do it right? Hold on, I have a few tips for you, and you guys. Take children's feelings seriously. A crying child needs comfort. Believe it or not, you don't have to be afraid isn't the best way to respond to a child's fear. It diminishes the feeling, making the child think their concern is inappropriate and maybe even forbidden. A better response, I understand you. It scares me too. Wait, you want me to admit that I'm scared too? Won't that scare my child even more? Nope. Don't be afraid of your own fear. Children benefit when adults are authentic. In order to have a conversation about feelings, adults should be aware of their own emotions and capable of expressing them. What we shouldn't do, however, is overwhelm the little ones with our emotions. They shouldn't feel like they have to soothe and comfort us. Okay, I got that. But what do I say now? Let the child guide you. You can use the child's questions to determine the level and complexity of the conversation. You shouldn't lecture, just guide based on what the child wants to know. What if my child asks what we can do to help? Is it a good idea to participate in protests with children? I'm glad you're asking. That brings me to my last point. Children expect adults, and especially their parents, to protect them. That means that being informed and having a fact-based conversation sometimes isn't enough. We can also try to make positive change with our children by participating in a demonstration, for example, or collecting donations. Do you know what self-efficacy is? The feeling of managing a difficult situation on your own. Exactly. We can't solve any of the major crises as individuals. But within our means, we can work to make change, thereby strengthening our self-efficacy and reducing feelings of helplessness. This applies to children, but also to adults.
Doing something for yourself is a way to cope with a crisis. It's helped lots of people during the pandemic. In India, there are also volunteers who support affected families with groceries, medicine, and money. For some of them, it's a part of their belief system. That's the case for these volunteers at an NGO near New Delhi. There have now been more than 1.8 million infections in the region.
These men are volunteering their time to practice a central tenet of Sikhism: service to the community. That includes distributing free food, also known as langar. Gurpreet Singh Rumi, the head of this Sikh temple, says that these meals will go out to the homes of coronavirus patients.
There is no discrimination here. Members of every community sit together to eat langar. We are even packing langar here to send to the homes of people who are unwell. This is what Guru Nanak taught us.
Last year, this commitment to service made the difference between life and death for thousands of people. India's second wave of coronavirus cases, driven by the Delta variant, overwhelmed hospitals and exhausted oxygen supplies. We visited the camp set up by Khalsa Help International to distribute free oxygen.
We need 100 oxygen cylinders every second day. We have 8 trucks storing supplies all over India right now. We pay for the oxygen in full and we distribute it for free here.
In 6 weeks, the camp helped over 14,000 people. Deepa was one of the volunteers at the medical center. Her family didn't want her to work during the Delta wave, given the risks at the oxygen camp. But then, Khalsa Help saved her uncle.
My uncle searched everywhere in the state and he couldn't find medical oxygen. He finally got help here. Now my family completely supports my decision to work here. I feel proud of being part of this.
For those whose lives were saved during this difficult time, Rumi is a hero. But he says serving the community is integral to his faith. The temple offers free medical treatment and checkups, as well as coronavirus vaccinations and tests. They're also providing support to families in financial difficulty due to the pandemic.
We've adopted 62 families who have lost their breadwinners to the coronavirus. We pay their children's school fees, we send them food rations and groceries. We will bear their costs until one of them can start earning.
Things are calm right now. But Rumi says his team is already speaking to medical experts to find out how to prepare for the next wave. His own bouts with the coronavirus don't scare him, he says. He's just trying to live up to his duty to help.
Our science correspondent, Derek Williams, has also wanted to help out since the beginning of the pandemic. He answers your questions and hopefully removes a little bit of your uncertainty in the process. This time, Susan M. wants to know, what does research say about repeated infections?
This is one of those million-dollar topics that we're still learning about. It's been clear from the beginning of the pandemic that SARS-CoV-2 might potentially reinfect people regularly over time. After all, there are other coronaviruses, the four which generally cause cold-like symptoms, that can infect us multiple times throughout our lives. Now, 2 years in, it's clear that SARS-CoV-2 might share that ability. We know that immunity to it wanes over time. That's why COVID-19 vaccine booster shots are now recommended. But what does the potential for reinfection really mean? Well, let's look at what the data says so far. Since we know that reinfections are possible, a big question is how often they could reoccur. Health authorities largely agree that an otherwise healthy individual who recovers from COVID-19 is at low risk of getting it again for at least a few months. But that's not zero risk. It's basically impossible to quantify your own individual risk because each person is going to have a different immunological experience with the disease. Some infected people will get bad cases and others won't even notice they were infected. And those experiences have an influence on your immune response to subsequent exposures. One place the evidence is really pretty solid, though, is that what's called hybrid immunity, which is a combination of vaccination and infection, that it provides more robust protection than infection alone does. So experts say that even if you had the disease, it's still a good idea to go ahead and get vaccinated anyway. But it's also important to note that the Omicron variant has changed the playing field because it's more immune evasive than earlier variants were. That means that it's better at infecting people with existing immunity, whether they've acquired it from vaccination or from prior infection. That ability, the experts say, is a big factor in the massive spikes in numbers of infections that we've seen in many countries in the last few months. But what does that mean when it comes to disease severity? I mean, if you get COVID-19 again, will it be less severe? There, the news from studies is cautiously positive. One conducted in the Middle East involving over 1,300 confirmed reinfections, for instance, said that they were 90% less likely to hospitalize or to kill people the second time around. So when reinfection does happen, most experts are saying they would expect the course of the disease to, in general, be milder.
Some people have used art to process what they've experienced during the pandemic, including a young photographer from Bangladesh who now lives in Berlin. She created a series of photos that have been featured in an exhibit. They're dedicated to the people in her homeland and their suffering.
The way people died all alone, no? It was really super sad things to see. So I know lots of people, they lost their parents, relatives, and they couldn't manage to see them for the last time as well.
Salma Abedin-Pretty aims to show the effects of the coronavirus pandemic in her home country Bangladesh with her photo series Torn. It's also a way for the 37-year-old artist, who now lives in Berlin, to come to terms with her own distressing encounters with the virus.
My father-in-law died that time, and also I got bad COVID. I had permanent damage on my right eyes, and I got the spondylitis disease through the COVID. And you can imagine so many things, and we didn't have that much time to think about loss and pain. We are just having so many things one after another. Then when my father-in-law died, and then after 8 months later my mother-in-law also died, and I got this long time COVID. So I feel that I'm in a battlefield and fighting all the time with the situation. I had actually no plan to work on COVID. So when the COVID came to Bangladesh, everybody is super scared. We don't know how to react. We don't know nothing. So in the meantime, there was lots of news came to the newspaper and social media, which surprised me a lot, shocked me a lot, and I started collecting those news.
Personal experiences were not being featured in Bangladesh's strictly regulated media. As part of a scholarship, Preeti began to focus on them and to show people stories in her pop-up photo studio in Dhaka.
I wanted to make something maybe more focus on trauma or more focus on pain, individually, in newspaper and documentary, maybe so many cases is coming one after another, but I wanted to make it focus on individual incident.
The plight of working-class people is at the center of Preeti's Torn series. The lockdown cast them into an existential crisis from one day to the next.
When the lockdown started, then we found that this situation very much extreme for the working class people. We knew we knew that these things exist, visible, but we are very ignorant. So that time I first experienced that someone is coming in front my road and asking for rice. And working class people, they don't know. They work on daily basis and they get payment and they live their life like this. They don't have any savings. So one of mother, she just sold her hair to get some rice. They this kind of people, they suffered a lot, and they are starting telling that it's better to die with corona rather than hunger.
When Bangladesh's garment factories reopened with the coronavirus still prevalent, workers were suddenly faced with a new kind of problem.
When they stay in the city, they have to rent a place, and small place, lots of people staying together because they cannot afford to be alone in the city and afford one room. So in a one room during the COVID time also, when everybody is talking about isolation, if you go to the slum, how could you manage the isolation?
Preeti blames Bangladesh's class society as well as the government's poor COVID policies for people's needless suffering during the pandemic.
I read a news, one of the policemen, he did suicide when he got COVID. He just fell off from the roof. He jumped, I should not tell fell off, he just jumped from the roof. He was so scared also. And if you don't have clear direction on anything, people get more confused and more depressed. They don't know what to do with this thing. They're more scared and more incident will happen. Yeah.
Torn has already been on show in Berlin, where the photos were also shortlisted for a talent award. The jury citing their impressive and contemporary take on this subject.
We've all learned many new ways to deal with the coronavirus pandemic, whether alone, together, or providing help for others. Hopefully, we've been able to provide you with a little food for thought. The virus and its mutations will be with us for a while, making innovative approaches that allow us to better cope with the situation all the more important. We'll explore some of them in our next show. Until then, so long and stay healthy.